Hi, this is Gabby. I'm here with Dr. Cohen. This is our patient, Mr. Speary. He came to us for his right lateral epicondylitis, which is also known as tennis elbow. He's 10 days out from his surgery. And that's what it looks like. And he's here to talk about his experience and how he's doing after surgery.
Hello everybody, my name is Bill Sperry. I had this issue for over a year. I had seen multiple doctors prior to seeing Dr. Cohen. I've tried everything to solve for the issue. I did rehab, I did cortisone, I did rehab, I did cortisone. Nothing worked, and I got to the point where, as a father, I want to be able to experience my life with playing with my kids and going back to working out. And after about a year of dealing with this, I decided to move forward with the surgery. And 10 days after the surgery, I now can actually make a fist, and my elbow doesn't hurt for the first time in about a year. And as I said to Dr. Cohen, I'm a little scared to say that because I want to make sure it stays like that. But right now, 10 days after surgery, I can do this and there's no pain. And it's, I would suggest it to anybody, to be honest with you. If you were going to be having this type of issue, there's no point living with it. You don't have to make that choice. You can actually make a choice to change the way you live your life, and the surgery is a good change.
How was the pain after surgery?
Day one, nothing, but that's day of drugs and anesthesia. Day two, took a little bit of pain medication. I'm not a big fan of it at all. After day two, I've taken none in reference to pain medication, and I'm actually pretty good right now. I've been using a lot of physical therapy, which is local here, and it's worked out great.
All right, and then show everybody your elbow.
Oh, sorry. There we go, this way, and this way, and this way. And then we'll just do one of these karate chops. And that's my range of motion as of today, 10 days after surgery.
Perfect. Thank you.
Thank you.